There's a conversation that's been going on in this community for quite a few years now, and that conversation has been focused on how do we improve our community. The leadership has stepped up and said, you know, we really need a broader vision than what type of buildings we're going to build. They've expanded the vision for what we ought to do in Douglas County, and the vision now is how do we create a system of care where people move from crisis and illness and incarceration to recovery and prevention.
So healthcare in our country is really fragmented. You often have to go 2 or 3 places to get the services you need. At Heartland, we've taken an integrated approach, providing behavioral health services at the same time that people receive primary care. In the emergency department, we're going to take the same approach, providing enhanced behavioral health services along with peer support and, as needed, connection to social detox the day that people are seen in the emergency department. They're able to get what they need and get home faster, to really help them get connected to the services that they need to stay home.
Sometimes the distance between leaving the emergency room and getting to that community partner's door seems insurmountable. Our goal with care coordination is to have that person there to show somebody the way and to walk them from one door to the other, to be able to say, this is how you do it.
So we know that people will always end up in the emergency room, and we want to be there when they're in crisis to be able to serve them. However, we also know that there's a better setting and a better place to do that. That's why our community partners are so important, and for us that's why the crisis center is so essential.
So the idea of a crisis center based here in the community is we want to keep people in the community out of an acute care facility where they are probably not going to be as well served for their needs as we can serve them here in the community. So it gives us the gift of time to work with individuals here in our community. We get to give them the tools and the resources that they need right here in Douglas County.
We know we lack detox resources in this community. What we will be doing is providing medication-assisted detox in the crisis center as the first step of someone's recovery. What we know as a provider is the one thing that gets in the way is lack of supportive housing.
Housing is a critical piece for any individual suffering from mental illness, substance abuse, or addiction. And we have a much better chance of success for these individuals having the opportunity to live successfully and stably in our community.
And the first piece of that would be comprehensive prevention planning, where we would identify specific prevention programs that would address the specific issues around substance use disorder and mental illness that we're having in our community, so that we can put in place those prevention programs that we know work.
If we're going to meet people where they are, we need to know how to find them. And the way we do that is through data and collaboration. By identifying those people, we'll be able to provide the resources to them that they need.
Communities create better solutions when they work together. You know, this isn't Lawrence Memorial Hospital's plan, it's not Burton Nash's plan, it's not the county's plan. It's our plan. And it's the result of all of those experts and agencies working together for years to find the right solution. What's right for this community? What's the right scale of service? What's the right facility? What are the right programs? I'm tremendously excited about this plan because I think it's the result of a community coming together for our community.